Hello and welcome to another episode of your AKT Podcast, which is hosted by wellmedic.co.uk. You are reviewing a 75-year-old male patient who has presented with a 12-month history of worsening breathlessness. He is waking up during the night feeling breathless and is often so breathless that he has to use several pills to fall asleep. On examination, you find that the patient has bilateral chest crackles and lower limb swelling to both ankles. You've arranged for a number of initial investigations, and your blood tests of your full blood count, your renal profile, your liver profile, your bone profile, and your thyroid function have all come back as normal. You've done an NT-proBNP, which is in excess of 2000 at 2400. You've also managed to do a spirometry, which shows an FEV1 over FVC ratio of 0.85. Your urine dipstick is also normal. What would be the most appropriate management for this patient? So in order to answer this question, I would like to signpost you to the nice visual summary for the diagnosis and management of heart failure. Both of these documents visually highlight the pathway required for patients with heart failure. Now, in this scenario, we have a patient with very typical symptoms with a raised BNP. The key here is to determine the next step. So would you consider arranging an echo from primary care, or would it be a direct referral to cardiology? So given that this patient has such a high reading of their BNP, the guidance would suggest that you refer to cardiology on a 2-week wait referral, as the BNP is in excess of that 2000 mark. And this demands that because there's such an increased mortality with such a high BNP. Now, had the result been between kind of 400 to 2000, then what you would do is refer them to be seen within 6 weeks. I hope you found this scenario helpful, and please share them with your GP training colleagues. This podcast is hosted by wellmedic.co.uk. We help GP trainees pass the AKT.